incidence of stroke in Nigeria from 1995 to 2016 was 26.0 per 100,000 persons. The 30-day case fatality rate for stroke is as high as 40%, and the current prevalence of stroke is 1.14 per 1,000 in Nigeria. We are going to be taking a look at stroke today on Health Matters, your TV health program on Osrc TV. My name is Shara Omonori. With me in the studios today is Dr. Akin Akinyuga. He is a family physician at the Department of Family Medicine, Federal Medical Center, Owo. You are welcome to the studios.
Thank you very much.
When we talk about stroke, we've taken a look at the statistics. Can you give us an explanation and in-depth knowledge about stroke?
Thank you. Stroke is the damage that occurs to the brain when there is a disruption or an interruption to the blood supply, to the brain, either as a result of a blockage or as a result of bleeding into the brain tissue. It's a neurological dysfunction, but the thing about it is that it is a medical emergency, and so one needs to be fast about it. And because of this disruption to the blood supply or disruption of the blood supply to the brain, the oxygen or the brain cells, they are starved of oxygen, and then if nothing is done to that, it can lead to damage, and then that damage will now result in loss of function of the parts of the body, because we know that the brain is like the power center, is like the Osrc, of the body, and that's where a lot of decisions are made. Things that control parts of the body, functions of the body, they come from the brain. So the damage will occur to that part of the brain that is temporarily or permanently starved of oxygen, and then that will result in loss of function of the affected parts.
Okay, thank you very much, doctor. You said earlier in your explanation that stroke is a medical emergency. Could there be predisposing factors, or what exactly are the causes of stroke?
Yes, the causes of stroke are, like it's been earlier explained, there is a disruption, an interruption to blood supply of the brain, and then that disruption can be as a result of a blockage of the blood vessel or a rupture of the blood vessels to the brain. And then being that as is may, we'll now talk about the risk factors, that is factors that can predispose an individual to having strokes. Generally we divide them into two, or they are divided into two. We talk about modifiable risk factors and then non-modifiable risk factors. When we talk about modifiable and non-modifiable risk factors, we are talking about, for non-modifiable, we are talking about things that an individual can do nothing about.
Okay.
While modifiable risk factors are things that an individual or the general populace or population can do something about to reduce their risk of stroke. Talking about the non-modifiable risk factors, age. The risk of stroke increases with age. We cannot do anything about our age. We are growing older every day. And it's been said that the risk of stroke doubles, for every 10 years after the age of 55. So age, there is nothing we can do about that. Then race, there is nothing we can do about our race. It's said to be commoner among blacks. And even in the US, it's commoner among the black Americans than the Hispanic Americans. Then the issue of gender or sex too, statistically, sometimes ago it was said that it was commoner among women. A time came again that it's commoner among men. But the fact is that it affects both men and women. So whether you're a man or a woman, stroke can affect the individual. Then another thing about the non-modifiable risk factors is family history. If somebody has a family member, especially a first degree relative, a parent, especially a parent or a sibling that has stroke, then the risk of that individual having stroke is also higher than other the general populace. Then individual genotype, especially when it now comes to the genotype, sickle cell patients or individual that has the genotype SS, they are at risk. You can't do anything about one's genotype. They are at risk of having stroke. And then genetics now, that is the individual's genetics. There are some familial syndromes, we won't go into that can also predispose an individual to having strokes. Now let's talk about the modifiable risk factors, which it's very important, and these are things that we can do something about. Top on the list is hypertension. For individuals who have persistently high BP, especially systolic high blood pressure, they are at risk of having stroke. Then those who have diabetes, in fact, it's been said that diabetes on its own is an independent risk factor for stroke. So if an individual have a problem with blood sugar, then that individual also has to be wary. Then if the blood cholesterol is high, that's blood cholesterol, lipid, we talk about dyslipidemia. If one has problem with cholesterol in the blood, then it can put an individual at risk. Then another thing that one modifiable risk factors also include the lifestyle of individual, that is taking alcohol, smoking cigarettes or tobacco use in any form, and then substance abuse, illicit drug use of cocaine, especially among young people. These are things that can predispose people to having stroke. Then talking about obesity, if one is overweight or is obese, having a body mass index that is greater than normal, then can predispose an individual to having stroke. Then physical inactivity. We live in a world now that has been taken over by TV, video games, technology, and things like that. So a lot of people are more inactive now compared to those days. And so physical inactivity is one of the things that can also predispose individual to having stroke. Then if one has had a previous history of stroke in the past, then it can also predispose an individual to having stroke again in the future. Then other medical conditions that can predispose individual include HIV. The world is focusing more of COVID, but the truth is that HIV is still around. HIV is one of the things that can also predispose individual to having stroke. Then recently too, there are other things that have been found to predispose to stroke, like psychosocial stress. Especially at home and at workplace. Stress generally, yes, can mental predispose stress. Yes, mental stress can predispose individuals to having stroke. And then depression too. Those are things that can also predispose individual to having strokes. Other drugs, especially use of oral contraceptive pills, especially the abuse of those drugs too, can predispose people to having strokes.
Wow, that's quite enlightening. Thank you very much, Doctor. You've talked about all the risk factors and the things that we can do, or the things that we do not even have control over, that can make an individual to get a stroke. Now let's look at the symptoms. What symptoms can you, maybe by mere looking at the person, or can an individual feel to know that, okay, I'm having an onslaught of a stroke?
Thank you for this very important question. As a matter of fact, I believe that the purpose of this program is to enlighten the general populace.
Of course.
And stroke has to do with time. When we're talking about what stroke is all about, we said it's a medical emergency. And then that means that people around that individual, or that individual himself, should be or must be able to identify symptoms or signs of stroke. Now, there is a popular or an acronym that can help us to remember the symptoms of stroke. It's been said that the acronym is B FAST. B then FAST, F-A-S-T. The B talks about balance. When there's a sudden loss of balance, somebody who has been walking normally before, and suddenly having this incoordination, not being able to coordinate himself or herself, losing balance, and sometimes even falling. We've seen cases where somebody is walking and all of a sudden the person just falls. Yes, so that can be a symptoms. Then the E talks about the eyes. Somebody has been seeing clearly before, who has been managing his or her vision, they're suddenly having blurring of vision. Things just suddenly becomes muddled up. The person cannot see clearly, or even a sudden loss of vision in maybe one or both eyes. That can be a pointer to stroke. Then the common one, the F now, because we're talking about fast. The F has to do with the face. When an individual suddenly just develop a drooping of one side of the face. When the person opens the mouth or shows the teeth, one side of the face seems to be out of balance with the other side of the face. It's facial drooping or asymmetry. That can be a symptom. Then the A talks about the arm, a sudden weakness or sudden paralysis, complete or total, partial or total paralysis of the arm, and on the arm and the legs or the lower limbs on one side. We call it maybe hemiparesis or hemiplegia. Hemi means half. So on the same side of the body, it might involve the right arm and the right leg, or the left arm and the left leg. So sudden weakness, partial or complete weakness can be a sign. Then the S is the speech. Somebody suddenly developing a slurred speech. Speech is supposed to be clear. Everybody is supposed to be fluent, to be clear, and then suddenly the person develops a slurring of speech, or even inability to talk. Some can have stroke depending on the area of the brain that is affected. The person may not be able to talk. And then the T is the time.
Okay.
Yes, that when you see this thing occurring in an individual, then people should act fast and take that individual to the hospitals. Other things that can also come with stroke, one can begin to have abnormal body sensations, especially numbness. Okay. Numbness involving maybe one side of the body can also be a pointer to stroke. Some of the other symptoms may also include not being able to control one's bladder or bowel. That is, the person can just suddenly realize that he himself herself can no longer hold urine or hold feces. Those are things that can come with stroke. The other things that we also see in patients with stroke, some people can lose consciousness. Okay. A sudden loss of consciousness. Somebody who's been conscious before then, especially in the night. We see people that you spoke with them the previous night, and then the following morning maybe the spouse wants to wake the person up, or the children wants to wake daddy or mommy up, and they find out that mommy is already unconscious or daddy is already unconscious. That sudden loss of consciousness can be as a result of stroke, especially if it's the type that involves bleeding into the brain. Then confusion too. Somebody can just suddenly become confused. Somebody has been normally well oriented in time, in place, in person, then suddenly developing this confusion, just confusion. Those things could also be a pointer to stroke.
Wow, that's a lot, and I think it's important that we remember what the doctor has said. Be fast is something to take cognizance of, especially as it has to do with stroke. Let's go for a quick break, and when we come back, Dr. Akinyua is still in the studios to continue to tell us more about the myths and how we can prevent or manage stroke. Do not go away. Yeah, welcome back to Health Matters. Today we've been taking a look at stroke, the symptoms, the causes, the risk factors, and what exactly we mean by stroke. And we have Dr. Akinyua in the studio. He is a family physician at the Federal Medical Center, Owo. And he has been enlightening us more about stroke and the factors that can predispose one to having stroke, as well as the causes and the symptoms of stroke. Thank you very much for being with us, Doctor. Now, Doctor, let us go to the forms and types. We just know stroke is stroke for the layman at home, but we also, from your symptoms and everything, we've seen that this stroke can take different forms and types. Can you enlighten us more about that?
Yes, like we said, that stroke has to do with a disruption to blood supply to the brain, and that disruption can come as a result of a blockage or a bleeding. And so this blockage or bleeding also, that means there are two ways by which stroke can come: a blockage or a bleeding into the brain. Blockage of blood supply to a part of the brain, and then bleeding into the brain as a result of rupture of a blood vessel. So, and that gives us the two types, the two broad classification or types of stroke, which one is called ischemic. Ischemic means a reduction in blood supply. That's just the terminology. The other one is called hemorrhagic. Hemorrhage means bleeding into the brain. So we also have another type. Well, it's not part of the classification per se, but sometimes it can be a precursor, a warning sign that stroke is coming. That one is called a transient ischemic attack. Transient means it is temporary, it's short-lived. Ischemic is still talking about temporary reduction in blood supply to that part of the brain, then attack that makes it the emergency that is of sudden onset or sudden onset. So for the ischemic type, something blocks the pipe, the blood vessel supplying a part of the brain. Then the hemorrhagic, there is a rupture of blood vessel. And then the mini type or the transient ischemic attack is also called warning stroke or mini stroke. That one symptoms usually resolve within 24 hours and the person feels okay. But that's actually a warning that something bigger is coming. So for the ischemic type, about 87% of cases are usually that ischemic type. It's usually gradual, it usually occurs, it can occur at any time of the day, but usually the person will just feel this weakness, all those symptoms will come. Sometimes they may resolve maybe after 24 hours, sometimes they may not resolve depending on what is blocking the blood supply. But for the hemorrhagic type, one of the ways by which one can know that one is having hemorrhagic type, that is bleeding, is those people may complain of a very severe headache. And that headache, sometimes, according to the classical or textbook definition of that, or description, of that headache, is that is the worst headache of that person's life.
Wow.
The person describes that headache as the worst headache he or she has ever experienced. So that can be a pointer to the fact that this person is having a hemorrhagic stroke. And usually that hemorrhagic stroke is usually the one that also presents with loss of consciousness. And in fact, as a matter of fact, let's even go to another common thing in Yoruba language, what people call magun. Magun. Usually what people that have magun suffer is hemorrhagic stroke. Yes, at the height of that pleasure, the blood vessels can rupture. For those who already have maybe weak blood vessel or something like that, and then because of the rupturing of the blood vessel, blood fills the brain and then the person go unconscious. So those are the two basic types: ischemic type and then the hemorrhagic type.
Okay, thank you very much for this knowledge, doctor. Let's talk about ways we can do, or what we can do to prevent stroke or to mitigate against it.
Yes, thank you. This is a very important question. In fact, I think the cruise of this matter is for all of us to be able to prevent stroke. And as a matter of fact, it's been said that 80 to 90% of cases of stroke, they are preventable. And so that's the good news about it, that it's something we can do something. Stroke is a condition that we can do something about. So preventing stroke is at 3 levels. Usually in medicine, we talk about 3 levels of prevention: the primary level, the secondary level, and the tertiary level. The primary level is making sure we deal with the risk factors. That is, these things that can predispose an individual to having that condition. We try and address those issues before they get out of hand. Then the secondary level is what is usually referred to as the level of early detection and treatment. Like the question you earlier asked, that how can one identify an individual that has stroke? So early detection, you are beside somebody and you just suddenly see the person having the sudden weakness of the hand and legs, or one hand and one leg on the same side, having a facial asymmetry, having slurring of speech. Then you detect on time that this person is having a stroke, and then the person should be taken to the hospital. And in fact, it said the first 3 hours of what one does for an individual that has a stroke will actually go a long way in determining the outcome of that individual. So that's at the secondary level. The tertiary level is for somebody who has already suffered a stroke and needs rehabilitation. So that's the third level, that's the tertiary level. So coming back to the primary level, since it's been said that 80 to 90% of stroke is preventable, we need to address those factors. That, for example, in fact, the leading cause of stroke is hypertension. So for those who are hypertensive, they need to control their blood pressure. It is very, very important. They need to take their medication. They need to adhere to instructions. In those days, they say medicine is paternalistic. That is, it is the doctor that dictates to the patients. Now, medicine or medical care is patient-centered. That is, both the physician and the patient, they work in collaboration, yes, as a team. So the patient or the individual needs to take responsibility for his or her own health. So if an individual is hypertensive, is diabetic, or he has problem with cholesterol, then he has to manage those things. Then we talk about lifestyle. Lifestyle is very, very important. Modification of lifestyle. For example, the issue of alcohol. I know alcohol is a controversial subject among the general public, but the WHO, World Health Organization, made a statement on the 4th of January this year. And that statement, I want to quote World Health Organization. They said, no level of alcohol is safe. No amount of alcohol intake is safe. In those days, they talk about safe drinking, but now they say no level of alcohol is safe. Yeah, I know it's controversial for many people, but the truth is that you don't know the level at which damage can begin to occur in your own body.
Especially for us that don't go to the hospitals.
Hospitals, yes, thank you. So don't take alcohol, and if you are taking alcohol, try and cut down on what you are. Then for those who are using tobacco, stop smoking. Or cut down on your smoking and then stop smoking. Cigarette smoking has no medical benefits. All the research that have been done, there is no single benefit that comes with cigarette smoking or tobacco use. And then for those who are not smoking, they should not start. That's what it said. If you have never smoked before, then don't start. Then we also need to watch our weight, to ensure that we maintain a healthy weight. Then for those who are physically inactive, we need to start getting active. Now petrol is naira per liter, and I know a lot of people will start parking their cars or may start parking their cars at home. At least let's look at the positive side of it. People will begin to trek. Walking is very good exercise for us. So people need to work on their weight. Then if an individual has had a stroke before and recovered, that individual must ensure that he or she does not suffer another stroke, because another stroke or the second stroke is usually worse than the first stroke. So if an individual has suffered a stroke before or has had what look like a warning stroke or mini stroke, then that individual should take care that he or she does not have stroke. Then for those who have never been to the hospital before, well, thank God for you, have not been sick before. People need to go to the hospital for a medical checkup to know your numbers. What are those numbers that we talk about? Your blood pressure level, your cholesterol level, weight. One needs to know one's body mass index, your weight and your height. These are important numbers. Then blood sugar level is very, very important. In fact, one of the leading, we mentioned it the other time, that diabetes is an independent risk factor for stroke. So for those who are diabetic, they need to control their blood sugar. And if you have never done your blood sugar test before, please, it's high time you visited the hospital for a blood sugar test. And then substance abuse, especially among young people. We need to run away from substance abuse. Heroin, marijuana, all this, shisha and some of these things that we talk about. These are things that can predispose individuals to having stroke. So lifestyle is very important. Exercise, we need to do exercise. Then if you have never done your genotype before, I want to encourage parents, if you have children already 1 year and above, 1 year old, please take them to the hospital, let them know their genotype. It's very, very important. Then you should also know your family history. You should also know your family history. If there's a history of stroke in the family, you already know that you are at risk. It doesn't mean that you will have stroke, but it only means that you are at risk compared to a family that don't have. So it's important that you also know your family history. Make sure you take good care of your health. Then diet is very, very important. What goes into our mouth is very important. Salt, sugar, we need to cut down on those two S's, salt and sugar intake. We need to cut down. Then fruit and vegetables. There are important things that cut across every age group. That is very good. So diet is also very important.
Okay, thank you very much, Dr. Akin, for that wealth of knowledge on stroke. Before you go, I would like you to use, you said 3 hours, the thing you do in the first 3 hours of when someone has a stroke is what determines the outcome of a person's life, I guess. So please make this an advice to the public by enlightening us more. Thank you.
Yes, my advice to us for viewers out there, we've talked about the symptoms of stroke. If you see anybody that has any of those symptoms we've talked about, please get the person to the hospital as soon as possible. If you were to be living in the US, you will say dial 911. In Nigeria, there's no number to dial, but make sure you take the person to the hospital, because those first 3 hours, they are very, very critical. They are critical hours that can determine the outcome of that individual. My other advice is, please go for a medical checkup. You don't have to be sick before you go to the hospital for a medical checkup. Know that stroke is an emergency. A lot of stroke cases they are preventable, so you need to work on prevention. And then finally, your lifestyle will determine your lifespan. So make sure that you watch your lifestyle and maintain a healthy lifestyle.
Thank you very much, Dr. Akin, for coming onto this program. You definitely have to come back, because it seems you know how to teach very well on health matters. Okay, thank you so much. That has been Dr. Akin. You are a family consultant at family physician at the Federal Medical Center Owo, that has been teaching us on how we can prevent stroke, especially. Remember that when it has to do with stroke, remember what the good doctor has said: be fast. My name is Feishara Omonori. Until next time on Health Matters, do stay healthy. Bye.